Hallux limitus or Hallux rigidus are both the same condition and describe a problem that occurs in the base joint of the big toe. When your big toe starts to develop pain in the area of the bunion or of the base joint, pain can occur for several reasons. It can be from a bunion prominence, and if you're noticing a bump on the inside of your foot, kind of across this area here, then that may indicate that you have a bunion. Bunion typically is not very painful as long as you're not wearing shoes, and in barefoot walking doesn't typically cause pain. If you're noticing that you have pain regardless of whether you have shoes or whether you don't, you may have a condition called Hallux rigidus or Hallux limitus. And what Hallux rigidus is a development of arthritis or loss of cartilage in that base joint. So the joint we're talking about here is the joint at the base of the big toe, so that I'm touching there, not the joint at the tip of the toe, but rather this base joint. And usually it will involve a prominence or an enlargement of the top of that joint, sometimes on the inside edge, and it'll also be associated with loss of motion. If you compare that motion of that toe to the other big toe on your other foot, you may find that your motion is significantly reduced or less significant. Now, if you do notice this, then there are several things you can do at home to help to reduce pain. And the first thing that I would recommend is going to a shoe that has a wider or deeper toe box, and also try to seek for a shoe that has less motion or less bendability at the toe portion of the shoe. So a stiffer sole can be very effective to reduce some of this pain. The use of anti-inflammatory gels or local applications can help to reduce symptoms somewhat, and even a short course of anti-inflammatory drugs like Motrin, ibuprofen, naproxen, or Aleve. Any of these can be effective in reducing symptoms for a short period of time or even for a fairly extended period of time. If you find that after treatment for a couple of months at home and trying to reduce symptoms from your toe, we usually recommend that you see your doctor. When you see your foot doctor for this, he will question you as to the reason for this developing, and you may find that in your history there might have been an injury to your toe at some point, either from sports or hiking or some other activity that may have led to the development of arthritis. He or she will also have you get an x-ray of your toe, and then x-rays are usually the definitive way of determining whether this is an arthritis condition or whether this is more of a bunion. If it is an arthritis condition or Hallux rigidus, then treatment is usually those things that we discussed at home. He or she may also consider an injection for your toe using a corticosteroid or a steroid injection. Steroid injections in that toe generally are not too painful, and after the first few days tend to reduce pain significantly for an extended period of time, sometimes even up to a year, depending on how severe the disease process is. The problem with Hallux rigidus is that it is progressive in most cases, and the stiffness tends to get worse over time, and the pain tends to get worse over time in most people. As this progresses, and if the shoe wear changes are not effective and injections have not been able to resolve your symptoms, then the next step in treatment can be several things. And the first surgical way of treating the condition of Hallux limitus or Hallux rigidus is something called a cheilectomy, where your doctor will actually make a small incision on the top of the toe and then take away the spurs that are developing on the top of the metatarsal head and in the base of your proximal phalanx or the toe bone. When those spurs are removed and space is created, it allows for better motion to occur. Sometimes he or she may also make an osteotomy of the bone, where the bone is actually cut and a wedge is taken out of one of those two or both bones to allow for better motion and to put that motion in a different plane so that it functions better for you. Sometimes the cheilectomy, the removal of spurs, and the osteotomy occur at the same time. The next possibility for treatment, and often the most definitive and the gold standard for this, would be a fusion of the first metatarsal phalangeal joint. A fusion stabilizes the joint, takes away the pain very effectively, but also stiffens the toe and can make it difficult for some types of shoe wear, and activities can be generally pretty well tolerated, but sometimes modifications have to be made after a fusion. One of the problems with a fusion also is that it causes more stress on the next joint in the toe, and over many years that toe can develop further arthritis in that area. Next to the final option would be a joint replacement, which has been used by podiatrists in this country and around the world for a long period of time. And that can mean replacing both portions of the joint, or using some type of a silastic or silicone-like material that's a little more stiff but allows for motion to occur. And then finally, the last step in treatment would be some more experimental things, which can include arthroscopy, which would be a scope of the toe joint to reduce and to take away pressure areas, and sometimes if it's a very mild condition can be effective. And then in addition to that, there are different ways to put membranes of cadaver tissue to help to line the joint and to reduce pain that way. Most of these are very experimental and at this point haven't been demonstrated to be effective over a large population of people.